I would like to open the first session with a talk from Dr. Deborah Leveille. Dr. Leveille is a leader in nursing education. She serves as the National Nursing Curriculum Committee Chair for a 20 campus college system in the United States. She is an expert in curriculum development and active teaching learning strategies and has successfully modified curriculums and implemented teaching learning strategies that have produced immediate improvement in student outcomes and faculty development and satisfaction. To talk about innovative teaching strategies, face-to-face and online formats that will engage students and improve outcomes, let us all welcome Dr. Deborah Leveille, PhD, RN, CNL.
Thank you. Great. All right. So I'm going to talk about innovative teaching strategies, face-to-face and online formats that'll engage students and improve outcomes and satisfaction and have fun while you're doing it. So this presentation, it's going to be fast and furious. It's really 3 presentations that I usually do nationally and internationally. So first, we're going to talk about the pandemic and how the barriers that it created that Dr. Nelson just discussed, and how we had to get creative in people who were face-to-face and are comfortable face-to-face teaching were just thrown into online teaching. And some people, it's just not their thing. So to have some tools in their toolbox to work with, and I'm going to give them some of this that you can use in the classroom or on a Zoom. So the transition will be easier for people who are new to online formats. So the biggest barriers that we faced with COVID were, how are we going to make sure that our students are confident with their skills? Because, you can go to the next one, Tarek. Because we didn't have our labs, we couldn't have students at the campus, so we couldn't be in our simulation lab or our skill lab. And most of the clinical sites were not allowing students. I mean, they just totally cut the students off. Finally, many of them at least allowed seniors to go in. And I was in Montgomery. I'm new to California. So in Montgomery, they allowed seniors to start to work as nurses. And they were apprentice, and we're going to talk a little bit about that later. But how do we measure their competency and make sure that they maintain those competencies? So those were the biggest challenges, because we want to make sure we can watch a million videos, but if we don't develop the psychomotor skills, we're not going to be safe. So we can go to the next one, Tarek. So here, this was back in a slide from last year, and I just had to change this to 2021. It was 2020. I thought that we would be back in the hospitals by then. But you can see how many hours that we need to have direct patient care. This is an associate degree program, but it's similar to a bachelor's program, how many hours that you need in each specialty. So it was really challenging. And back in Montgomery, they did want us to do direct patient care, but they were pretty lenient. They did let us do a lot of virtual sim. But here in California, they are pretty rigid. They really want you to be in the hospital, and they really want the hospitals to allow students to do their clinicals in the hospital for the rotation. So they really want you to get that hands-on experience. But it was really challenging. And I heard about telehealth, but now having Dr. Nelson explain it, it's really, I think it should be in all the programs, because this isn't just a one-time thing, I don't think, with COVID. We're going to see this in the future. So the next slide, Tarek. So we got creative, and if you go on to ACCN, they have a list of virtual simulations and alternative clinicals, and the list is just getting longer and longer. So if you don't have that yet, I can send you that link. It's kind of hard to find on the site. So we had the virtual sims. And at this time, back when COVID, everything was closed and it was so challenging for all the states, I actually worked for the Board of Nursing in Alabama and was privy to all their conference calls with all of the states. And it was really interesting to hear what everybody was doing. So here's some of the things that people were doing in different states. They were allowing virtual simulation to equal 2 clinical hours They were moving clinicals to the next quarter, hoping that COVID would be over, but obviously that didn't happen. We're still in COVID times here. And also, if the students were ready to graduate, they allowed them to be apprentices. And the hours that they worked at a hospital were used towards their simulation in clinical hours. And also, some of the states extended their temporary licenses up to a year, which I'm not really too fond of that, because what happens in a year, and when they sit for the boards and they don't pass, they have been practicing as a nurse for a year. I don't think that's a good policy to have. So next slide, Tarek. So we did get really creative, and you can look at the virtual sims. They've really come a long way, and I don't know if anybody's taken ACLS or BLS. It's really challenging. You really feel like a real life situations, and there's a lot of critical thinking. But still, you don't get that you don't develop the psychomotor skills that you need to be safe. I used to be a medical malpractice paralegal in Boston, and we had so many cases where, and I used to hear this all the time when I was in nursing school, is that, you need the knowledge, but you can teach monkeys the skills. I disagree. If you don't develop those psychomotor skills, then you are so absorbed in what you're doing that you don't even know what's going on around you, that the patient may not even be breathing because you're so focused you don't even notice that. So nursing schools, whether you're an ADN or a BSN, you have enough time to develop and refine these skills, and we're going to talk about that in a little bit. But they did really come leaps and bounds with the virtual sims. I think that's great, but direct patient care or telehealth, something that is really, you are speaking with a human being, that's what you need. And we can be creative. So next slide, Terry. So these are some of the guidelines. Like I said, I was tasked with, what are we going to do here in Alabama? Every state had to come up with guidelines on what are we going to accept. So the first thing was, if you can get direct patient care, especially for seniors, you have to try to get that for your seniors. And then we went to telehealth. We had a lot of people in Montgomery. Like I said, I heard about it. I didn't get in-depth detail about it. High fidelity simulation. But it was, if you have a large program like Dr. Nelson, it's difficult to get a couple hundred students into one sim lab. When you have to space them out and you have to clean it in between each one. So these were a list of things that we were going to do. But first and foremost, we did want them to have direct patient care. Next slide. So we are back on campus for Skill Lab only. So we still are doing the Hollywood Square Zoom lectures, but we do have students that they were just watching videos and you can't develop skills that way. So we do a little bit of lecture in the skill, and then we go into the skill lab, but we have sneeze guards, we have Clorox wipes, and now you have to think about with skills, usually you share, everybody gets to touch all the equipment. Now we have to wipe it down in between each one, or each student has to have their own piece of equipment that they're going to use each time. So it's really been challenging in that we've had to purchase a lot more equipment. Next slide, Tarek. And this is what we have our students wearing. We have the shields. We actually have N95s. We had to space out our beds so they're 6 feet apart. Or we use every other bed. So we have a 10-bed lab. So right now we're using every other. This is not our lab here. We have our Clorox wipes. So again, everything that we use, we have to wipe it down in between each student. So it's really been a challenge. Next, and I don't know, I'm wondering, when is this going to end? So this presentation is broken up into, the barriers that COVID created, preparing faculty for new and effective strategies that Dr. Glava, I can't remember, yesterday was talking about how difficult it is to get faculty to change. And this is a perfect opportunity because we've all had to change. So get them ready to change and have your new and effective teaching strategies. So next slide, Tarek. And then we're going to talk about what to teach and then how to teach it. And then we have some design for curriculum. All right, so usually I hold a workshop. So workshop objectives, we're gonna explain how to develop a course. Most teachers that when I come into a new program, they just go in with their PowerPoint. They don't have a game plan. There's no course outline. The students don't know what to expect, except for they're gonna show up in class and probably gonna have a PowerPoint. I like to get away from that. Activities that are going to reinforce. You don't have to have a traditional lecture. You can make it fun. Your knowledge, what you want to teach that day, can be in games, informative assessments. It doesn't have to be a straight lecture. And I wish I had more time, but we are going to look at some stuff. In most faculty, they don't understand what's formative and what's summative. And usually there isn't enough formative assessments that teachers are rushing in because they feel like they have to teach so much material that they don't have time to test their students before the summative. But it's really important, and you should have at least 2 formative assessments, one at the beginning of class and one at the end of class. And if you have extended classes at the new university that I'm working at, they have 8-hour classes. You can do several formative assessments, and formative assessments doesn't have to be just a pop quiz. It can be Kahoot, it can be Heads Up, it can be Password, it can be all kinds of fun stuff, because you just want to know, what do they know? What do I really need to reinforce during this time that I have with the students? And discuss formative assessments and design different formative assessments. Next one, Tara. So the competencies that they're going to learn how to develop active teaching skills, that they're going to encourage peer mentoring and include that somehow into their courses, assessments, formative and summative assessments. And it really is a good idea to teach your faculty about item writing. And the reason, and not everybody's an item writer, but if they understand item writing, then they understand what they should be teaching. Because like I said, a lot of teachers, they think they have to teach the whole textbook. The textbook is just a resource. I'm going to give the students what they need to know, and it shouldn't be more than 30 or 40 slides. And then they're going to use their textbook as a resource to go and fill in the, gaps, or, like, I don't really understand that, so I'm going to go into my textbook. I'm not a big fan of assigning 3 or 4 chapters and then saying, well, I'm going to quiz you tomorrow, and it could be anything in those 4 chapters, and it's like 400 pages. That is crazy, because if we tell a student, I want you to learn this much, they're going to remember this much. If I say, this is what I want you to know, that's what they're going to know. And we should only give them the information that they absolutely need to know to be safe. And that's what the Board of Nursing is for. And they have to retain it forever. And we have to be considerate, because everybody only has so much brain space and so much time. And the brain space that we want to fill up, we want it to be with important information, the concepts that they absolutely have to remember to be safe. Next slide. So course development, everything has to align with the NCLEX, obviously. And people go, oh, you're teaching to the test. Yes, that the test was made to make sure that our students, our graduates, are safe at the bedside. So absolutely, I want them to understand the NCLEX test plan. But everybody just knows the pie piece. They don't know, how is the NCLEX developed? What are the surveys? So there's 2 surveys. There's a nursing activity ranking and a knowledge statement. And these 2 surveys go out every 3 years, and they go out to all the facilities and all the new graduates. So the first year graduates get this survey, and it tells us, what do we need to know? What are the most important nursing activities and knowledge that I need to know? So the last surveys were back in 2017, and there was nursing activity rankings, there's 142, in knowledge statements, there's 295. And then they're married together, and that's how we make the NCLEX. And I always focus on the top 50 activities that I make sure right from the beginning, right from health assessment all the way through, that these are revisited frequently through the program. So not at the end of the program, we're not all rushing to try to cram everything back in. So it's very important revisiting all these key concepts. Next slide, Tarek. Creating class outlines. So don't just go in with a PowerPoint. There's actually, from 9 to 9:30, I'm going to do this activity. 9:30 to 10, I'm going to do this one. And it's all, nobody wants to go to a classroom and just sit and do one activity for 3 hours. You got to mix it up, and time goes by faster. It makes it fun for the students, and it makes it fun for the instructor. In every single thing that you do in the class, all the activities, all the quizzes, all the exams, again, have to be linked to the nursing activity rankings and the knowledge statements, not to your textbook. I hear from professors, they say, oh no, now I've got to change all my exams because the textbook changed. Well, did the NCLEX change when the textbook changed? No. And you have to educate faculty on this, that it's not all about the textbook, even though the publishers want you to think it is. And it's lovely. And I always tell my students, you keep your textbook. There's so much information that when you become a nurse, you're going to go back and you're going to learn. And that's great. It's a good reference. Next. So here it is. It's 2017. Here's the surveys that I was talking about. And then these two surveys are what they use to build the NCLEX, which it was going to be in 2022 that we have the next gen, but with COVID, we're bumped up to 2023 that we're going to start seeing that next gen model and higher level items. Next. So this is what it looks like when I'm talking about knowledge. So here's the nursing activity rankings from that survey. They don't put it in order. These are all the activity numbers from the survey itself. But what's the most important thing that they have to know to the least important? And you can see here, airway management, vital signs, medication administration. These are all very important safety measures. And then these two are married, they're linked together, and this is where they jump off and develop the NCLEX. So just if your faculty understand and they can see the list, like I need to know these, and they're just built right into your program, you're going to have incredible pass rates. The students are going to know what they need to know. Next one. So all the faculty seem to know this, and that's where they stop. But it's really important that they know under management of care, what are the nursing activity rankings that are under this? What are the knowledge statements that I have to assess that they understand this information? And you can see management of care is the biggest piece of the pie. And then we have pharmacology and physiological adaptation. And yesterday when Dr. Glava was talking about, can they identify and intervene? This piece of the pie here is that section. And like I said, in class, I actually have an activity. It's called Identify and Intervene. That's really fun that you're a nurse and you walk in and you see this situation going on. Is there a problem? Can you identify the problem? And then what are you going to do about it? And that's real life. Everything should be linked, whether you're in the classroom, skill lab, sim lab, clinical is linked to the clinical setting. Students have to understand, why do I have to know this information? You have to show them why they need to know it. Next one, Tarek. And then, so this, after educating your faculty on, on the NCLEX, now they should know what they need to teach, and they're going to minimize it so they're not feeling so rushed because I have to teach so much information in class that I don't have time to do these assessments, but they do, because now they're going to whittle it down just to what they need to know, and then they're going to start applying it. Next one, Tarek. So I have this is pharm. So this is basically the key concepts that they have to know in pharmacology. So now everything is going to be developed based on these key concepts. Every classroom activity that I do, everything is just going to reinforce what they have to know in this class, in my exams, everything. And again, the textbooks, they do not drive the course. You have to focus on essential knowledge. It's all about safety. Next. And here's our next gen, which is coming up in 2023. I mean, it's still the same as the nursing process. You know, we're developing, we're assessing the patient, seeing what they need, gathering all that information. And then we're going to develop some nursing diagnoses or hypotheses because we recognize the cues, we analyze it, and that's when we formulate that. We're going to have our refine them, and we're going to prioritize them. What do I have to do first and second? And I'm going to have interventions that I'm going to implement, and then I'm going to implement it, and then I'm going to evaluate. Did they work or did they not work? Do I need to go back and redevelop, make some other diagnoses or different interventions? So it's really the same, but they have added, you know, what else is going on, because it's very chaotic in the hospital for a nurse. It isn't just this straightforward. There's so many other things that are happening, and that's what these little circles are. And the next. So again, we're just pulling everything. And if the more you reinforce these nursing activity rankings, these surveys, and your faculty understand what exactly do my students need to know, and all of your items are aligned to these surveys. You know, I'm an item writer as well. And when I go into a school that's having problems, I look at their exams, and you know, it's a lot of the items are who cares? That's not what are we testing here? It's nowhere to be found on the nursing activity or knowledge statement. So that needs to go. And I'm telling you, at least 50% of the exams that I've looked at, that they just go from the textbook. But you have to align it. Next one. Sorry, Tarek. And this is what I give my faculty. I'm new at this university that I have, but in the past, this is what I have item writing guidelines, and here's management of care. Here are the nursing activity rankings here. And this is the whole list of the 142. And then we develop it. So every single item you can see is aligned to one of the nursing activity rankings and the knowledge statements. So we can really map out the exams. And we know that if we're covering these, especially the top 50, they absolutely have to know, they're going to pass the NCLEX. They're going to know what they need to know. Next one. And this is this is just a sample of this is health assessment. And every single one of their items has to match with a nursing activity ranking and a knowledge statement. And you can see that in the green here, and this is what our exams look like. And try to make it in the next one. I think I have another exam in the next one. You know, use the pictures. Try to make it as much like the NCLEX as you can when you're testing. And I really think online, and I'm going to show you some online test banks. And people were really thrown if you don't have an online test bank and you had paper, and now you're on an online format. It was really challenging for a lot of faculty. The next slide, Tarek. So do have, you know, little charts. These are things that you're going to see on the NCLEX pull down, but these are just paper exams. All of mine, we build out test banks because that is really what you should have. And if you're using textbook test banks, they're compromised. You need to develop your own. Every program should have their own item writing team and develop items, because then it's not going to be compromised, and it should just be right on the computer. Next one, Tarek. So formative and summative. Formative is low stakes. We're just seeing what do they understand. So when I say to do one at the beginning and the end of the class, what did the students know at the beginning of the class? And faculty have to be able to pivot here, because they go in and usually it's just a blanket of topics that they're going to talk about, and everything's equal that they're going to talk about, and you can't do that, because I come in, and when I do my formative assessment, I can see immediately when I collect them, or if I do Kahoot, or what areas are they weak in. That's what I need to concentrate. So now I've got to change up what I thought I was going to lecture. Now I've got to change it up a little bit right now on the spot and focus on those areas that they're weak in. Because I don't really need to spend as much time on hyperthyroidism, because they got that, but I'll touch on it, but they really don't understand diabetes insipidus. So I really need to talk about that more. So that's what that tells me at the very beginning of the class. What do I need? What do they need from me? What needs to be reinforced? And then at the end of the class, I do another formative assessment, whether it's a pop quiz. I like to do Who Wants to Be a Nurse? And really, it's who came prepared, who really wants to be a nurse. And if you can't answer any of the questions, you're out parking cars, or you're the janitor in the hospital. You didn't want to be a nurse. If you came really prepared and you got all of them right, you're like the CNO. You really want to be a nurse. And I use that because at the mid semester, when students say, "Well, I don't understand why I'm failing," when I pull out their formative assessments, I can see that they weren't prepared at the beginning of class. They never came prepared. And I say, "Well, you've been parking cars for this first half of the semester. You never came prepared. You got to pick it up." So the next one. Oh, and then summative assessments is that big high stakes. We use the ATI or the Kaplan. So those formative assessments, we want to make sure that they're ready for that summative. And another thing that faculty do is, even though they're not ready, they can see it from the formative assessments, they charge forward, and they really shouldn't. We're here to help the students and help them learn the material and make sure that they learn the material. We shouldn't be charging forward. I always tell my faculty, push it out, until you see that they understand the material. I mean, there's going to be a couple of students that don't understand some things, but if the majority are not doing good on the formative assessments, you shouldn't be charging forward with that summative assessment. It's not right. They're the client, and we're here to help them. Learning should be fun. This is one of my favorite sayings from William Butler Yeats. Education is not the filling of a pail, but the lighting of a fire. It should be exciting. And I don't know what higher ed does to people that beats out all the fun and makes it into a chore, because it should be. Remember, we were learning our colors and our numbers, and it was just so exciting. And we were like, "Oh boy, this is so great," and tell our parents. When they get to this point, they're not, it's a chore. And I tell them, don't look at it as though it's a chore, especially in nursing, because education is lifelong in nursing. You better love education. And if you can get them excited about it, we have more educators. Almost all of my students, because I'm a big fan of peer mentoring, they want to go into education. They want to do the bedside nursing, but they also want to be educators. So maybe we'll get some young educators. This is a lot of stuff that I use in the classroom, and I tell my faculty, this is what I have, but please use whatever education fun things that you could think of. And they usually come up with some really good fun games or technology that they use. Kahoot is free. I would definitely use it. Heads Up is, you can buy it, but you don't have to buy it. What I do is I just print out PowerPoint slides, and you can put that up. The person puts it up so they can't see it. It's just the same. You don't have to have it on an iPad or whatnot. Again, Who Wants to Be a Nurse? I can do open-ended or NCLEX style. I do scenarios, rolling scenarios, and we're going to look at that. Identify and intervene, short little scenarios. The nurse walks in here and they see this, and there's always something wrong with the scene, and they've got to figure out, what do I got to do? Game show, password, rapid recall. So whatever they visited, we learned last week, I always bring it into the class. Everything should be cumulative. And that's another thing that programs do, is we promote pumping and dumping by not making it cumulative. We tell them, oh, on exam 1, you're going to have chapters 1, 2, and 3. So then they study really hard and they pass it. And then we say, okay, next test 2 is going to be on 4, 5, and 6. So then they think, oh, I don't need to remember 1, 2, and 3. No. So I tell all my faculty, everything's cumulative. Everything's cumulative from the beginning of the program. When you have pharmacology, health assessment, you have to make sure, because they want to remember it, but we have to make sure that they do, because they feel like they don't have enough time. But when you make it cumulative, they have to remember it. So next slide, Tarek. We're going back here. Yep, so these are all, and I'm a big fan of group test retaking. So if I give a test, a paper test or a quiz, everybody takes it individually and then they take it as a group. And it really helps those weaker students understand how other students are reading the items. So then it lessens the time that the instructors have to spend with each individual student. But the only problem with that is that you have to change up your exams all the time because they're taking it individually, then they're taking it as a group, and then we're reviewing it as a group. But it really, really helps those struggling students to hear from other students on how they're reading and the peers. It's the peer mentoring. Next, Tarek. Okay, so here is the game plan. Here's my outline. So I want my faculty to have a plan. The plan isn't, I'm going to go in and I'm going to teach um, cardiac tomorrow with one big long PowerPoint. It's got to be, and give this to your students the night before so they know what to expect and they know what to study. So the next, and you can see here that it's all fun stuff, that it's not just a lecture. When we're doing the medication calculation and pharma review, this is some of the knowledge that it's an activity, but they're relearning the information. Some type of formative assessment. So I usually do a pop quiz on all the key concepts, and then I have follow-up questions immediately. So make it fun teaching them the key concepts. And that's what I spend the first half of my class is just getting them to know all the information, and then we apply it in the second half of the class so they understand it. Next one, Tarek. So this is just some of the stuff that we do. So this is the medication calculation that I just had on my outline. So we have a drug that they're going to tell me about, and we're going to type it. And usually I have a student, if we're in class, but now on Zoom, I just type it in there. But in class, I'm walking around the classroom and I have a student up there who's typing in, when the students yell out, oh, what class is that? Oh, H2 histamine receptor blocker. And then they type it in there. Why do we use it? What are the adverse effects? But they also have to do a calculation. So this is fun. We do about 5 or 10 of these. Next one, Tarek. And here's just another different math problem and a different medication. And this is all about GI. And next one, Tarek. Yeah, so don't put them to sleep lecturing with slides, or they're just going to be on their computer, surfing the net, doing some shopping. Make it fun. Have the Socratic questioning. They won't have time, and they won't be clock watching. I have many times gone over and have apologized because nobody's watching the clock. Make it fun and engaging. Get them excited about learning. Next. Give them what they need to know. So these were groups of students that developed these. They were having a hard time with HESI pass rates. They just couldn't pass it on the first attempt. So we called them HESI review sheets, but there was a team of students, and I said, you know what? On GI, on each system, I want it either all the key concepts just on 1 page or 2 pages, and that's what you have to commit to memory and never forget. So these were about 8 years ago, and every year I have students, we update it, we go over it. So this is just like the foundation. They have to absolutely know this, and then they have to know more. I don't tell them, oh, this is all you need to know, but these are things that you absolutely have to know. So every single system is on a sheet or 2 sheets, and I always give it to my students, and we always review it at least once a year because things change, and some things don't change, but just to make sure it's up to date. So next, don't make them try to memorize everything. Here's my Who Wants to Be a Nurse, and if anybody's interested in this, this is really fun if you get to be in class again, but it gets everybody engaged. I ask 10 questions verbally. They write down their answers. They have 3 pieces of little Post-it notes with their name on it. And in order, I have to collect all 3 of them. So they have to answer when I review the quiz with them, and I have follow-up questions. I've got to get the 3 pieces of paper from them for them to get credit. So everybody in this also helps with those people that always want to answer the question. They're every single one, all the students are all quiet except for this one student or 2 students that want to answer every question. So once I've received your 3 pieces of paper with your name on it, you got to be quiet and let everybody else participate. Next. And this is the open-ended with the follow-up questions. Again, if you're interested, just get in touch with me. And again, this is all knowledge, just instead of a lecture, this is how we review all the key concepts. Next one, Tarek. And this is an NCLEX style, who wants to be a nurse? So I pass this out, or now on Zoom. You can do all of this on Zoom. I can ask all those questions and I have them take a picture and send it to me so I can grade it and see where they, what they answered and where their knowledge deficits are. And the same here, but now I have it online. It's a little quiz at the beginning of class. Next. And this is, we review it immediately after, or I have a worksheet. So I may come in and we're talking about GI and I may pass out this is just one page, but to get it on the screen here, I may just pass this out and I have these tiny little blocks and the students go, but Dr. Leveille, this is like, what, the blocks aren't big enough. No, you cannot memorize everything. I want to know key concepts about Crohn's and diverticulitis. I don't want pages and pages of stuff. What do you have to know that you have to retain in your brain to be safe? So that's why they're small. They're small on purpose. So next. Here's the heads up. Like I said, you don't have to purchase it. It's 99 cents a game or something. Just print it out on PowerPoint and you can just hold it up in front of somebody. And what I do now, actually I use Password now. Or even if you do heads up, if I put up a new one, Password is just the same thing. You have the student online, whoever it is that has to do the guessing, they have to turn away from their computer and then everybody just yells out everything except for what's on the slide to get them to say Finding Nemo or whatever you have, Crohn's or diverticulitis. Next. But all of these you can do. This is, people said, oh, you can't do it. We have a stacked stadium and, we can't do group work or whatever. That's why we just do lecture. They're doing heads up. You can see here with the, she's holding the paper over the other student's head and everybody's just yelling out things, trying to get her to say that. And you only have a minute to do that. And the same thing, we had a very large class. This is 90 people that are in these classrooms. You can still do activities like this with a large class. Next, Tarek. Password, next one. This one, it's really fun. You get the student, like I just said, here online, you just have the student turn away from their computer. And now next one, Tarek. And then all of the students in the little clock, can you see it started? You have 1 minute and it's going to go off and you just yell out whatever dumping syndrome to get them to say dumping syndrome before that minute is up. And that's really fun. And you can still do that online. And really, you're just hearing what everybody's saying to understand. It's a formative assessment. Do they understand dumping syndrome? Because then if they're saying all the wrong things, I'm going to talk a little bit more about it. They're weak in that area. Next one, Tarek. So I have about 15 of these for whatever system that we're covering. And 15 is usually enough. Here's another one that I like to do. Name that drug and name that disorder. So if you just hit the button, antacid, and stop. Oh, no. So when you get to the asterisk, you stop. That's all the information I'm going to give them. Now they should be able to guess what the drug is. And then when they guess it, then I hit the button. And then I have follow-up questions. Like, what do we have to know about antacids? Is several medications, what's the best action of the nurse? Everything is linked to the clinical setting. And then I have another follow-up question. Yeah. And then we talk about antacids and why, what are the side effects? And it's just a fun way to do it. And next slide, Tarek. And then it's just a disorder that we can talk about. So I give them some information, then I stop, and then they have to guess it. And then I, go ahead, Tarek. And then we have more follow-up questions. So nobody has an opportunity to not be engaged. Everybody's got to be, yelling out whatever, and it's fun. Next. Kahoot, if most people know about Kahoot, it's fun, but don't overdo it. Students always want to like, oh, I just want to do Kahoot. Well, everything gets boring when you do it too much. So we do like to play Kahoot, and it's really fun, and you can cover a lot of information. Next. And this is what Kahoot looks like if you haven't played, and absolutely can do this online. So I would definitely recommend it. Oh, so now my presentation too, which isn't that many slides. Yeah, you have to share the other one.
Are we good in time, Jose?
Yeah, we got,
Yes.
yeah,
We
it's
still
only
have
10 minutes.
minutes. Yeah.
Yeah, because the next part is curriculum development, which is not as many slides. I'm sorry. Like I said, this is like 3 crammed into one.
Is this the one, Deb?
No, no, my next PowerPoint.
Well,
This was 1, and then I had 2. I had to break it in half. I sent you 2 of them. This one had 1 in front of it,
that
and then the other one has 2.
That was the second one I received. So this is the second one I received here. I
Well, this is number 1, and then there's another one that's number 2.
Okay. Yeah, I mean, this is the only one I have here. Like, this is the 2 files I received. This one here. Can you see the screen here?
Nope. I think you have to get rid of that first one.
Okay.
And then pull up the second one.
This is the one, Deb?
No, it's not showing yet.
Okay, hold on. This one?
Yes.
Okay, perfect.
So all of those little things that we did in class just now, Kahoot, those were all the formative assessments. And those are just the knowledge, they're learning the concepts. And now at the second part of the class, you should be applying the concepts in just simple scenarios, identify, intervene. What does it look like in the clinical practice? So next one, Tarek. So keep it simple, use key terms, use the labs and everything that they would see in the clinical practice in your simple scenarios, level to whatever course they're in. So this is just GI disorders. So next one, Tarek. So here's Bob. And Bob, he's got COPD, and this is again GI. And we give them a little bit of information. We talk about the meds they're on, and then we ask a question about what they should be thinking in the clinical setting. And Bob doesn't have it's a rolling scenario. He has to go in for a urea breath test. And this is a very short video. If you do have videos, keep them less than 5 minutes. Students don't like to watch a lot of videos in class. It depends on how long your class is. So next. So here's some simple labs that they should know. He has abdominal pain. He has black tarry stools. So they should be linking, like what should I be looking for? Oh gosh, the hemoglobin and the hematocrit are low. He's got black tarry stools. He's got a GI bleed going on. Next. So we have to do, check it for melena. Next. In scoping procedures. So and then we talk about the procedures and we walk through everything that Bob's going to go through. And they have to tell me about what do I have to do before this procedure, during, and after. Next. And how am I going to educate the patient? And then what are they going to do? They sclerose it. He's got a bleed, and it shows the sclerosing. It's a very short video. And then what are we going to do when he returns to the unit? Post-procedure care. So we're always constantly asking them questions. What are you going to do? This is your patient that just came back. Next. And these all obviously can be done online. And then he continues, the scenario continues. Next. And then we have just multiple cases. You can go to the next one. She has a procedure done, a barium swallow, and I have a short video. Next. And again, how do I prepare her? What do I educate her? And then we have Jane Jones. She's got colitis. Crohn's. Next. Next, we just, these are all their patients. Next. And then we have to talk about ileostomy. Oh, go back one. They have to tell me all about this. How are they different? How are they the same? How do I take care of them? What kind of teaching am I going to give Jane when she goes home? And then we show them changing the bag and doing an irrigation with the colostomy. Next. And then we revisit, just recap, revisit all these key concepts as much as you can during the class and throughout the program. And they're not going to forget it. Next. Next. This is just that identify and intervene. So client has abdominal distension, limited activity since surgery 2 days ago. This is your patient. Is there an issue with this? And what kind of action are you going to take? Next. So that's the same thing. Prioritizing, identify and intervene. How am I going to prioritize this patient? Who do I see first? Next. And just more questions. Next. Talking about TPN and different, it was prescribed for your patient. These are still identify and intervene. That runs out in the middle of the night. What are you going to do? Next. Next. And then just recap at the very end of the class, what are the key concepts? Always stay on that. They're not going to forget it if you keep on asking and revisiting. Next. Minute papers, how was your teaching? Get some information from the students. Don't be blindsided by your midterm eval. Do minute papers the first couple weeks so you can change up how you're doing the class, or maybe they don't like it when you do some type of activity, or they have some suggestions for you. So it's really good to do that before the midterm. Next. And take action. And then this is just a minute paper. It's just 4 questions. If you're interested in the minute paper, let me know. Next. Next. So make everything online. Now that everything's online, we build out all of the exams and the toolkits. So you should have them already there. You shouldn't have faculty scrambling, trying to prepare for the next, like, oh, I got class and I don't have anything. Build up your tool banks. I did this for the 20 campus college system that I had, and everybody could share it. Next. And these are all based on nursing activity rankings here, the activity statements and the knowledge statements. So I know everybody at these campuses are using, they're teaching to the NCLEX. Next. And then we also had test banks for RN and PN programs that are not compromised. And then linear and next. I'll just quickly go through this. So linear, most programs, traditional programs are linear. They just have a cohort or a person going through each class. There's not a lot of collaboration with other cohorts. You're just marching forward. Either you progress or you don't progress. Next. Yep. So it just builds on the previous content and we just march forward. There's not a lot of time for peer mentoring and all of that. Next. We have large gaps. So we learn in fundamentals, all that good stuff that we learn, but then we may not revisit it until the end of the program and everybody's, wondering if that cohort, are we going to get the 90% pass rate? And then we promote pumping and dumping and we teach in silos. So we've got to get away from that. And this is what I discuss nationally and internationally that I speak about is an integrated curriculum where everything is connected, everything is lined up, everybody's learning about neuro the same week, everybody's learning about cardiac as much as you can, because then you have those opportunities to peer mentor and you have opportunities for students to go back and sit and listen lectures. I don't have time to reteach cardiac, so they've in med surg. So it was lined up. So when they're teaching it in A&P, my student, I could send them to listen to those lectures. And students peer mentor in the labs. So there's just a lot of collaboration. It really builds a community and it really gets people, the students excited. Next. And always have those checkpoints. And don't use skill labs as just teaching in silos, return demonstrations. You should be teaching a skill and then applying it in a simple scenario, low fidelity or intermediate fidelity simulations. It's really an integrated curriculum. If you're interested, get in touch with me. I'd be happy to talk about it. Next. See, this is how I had everything lined up. Next. Yep, stop the pumping and the dumping syndrome. And I think my next one is my last slide. Oh, this is the peer mentoring in the lab. Next. 2 years, I've had programs. One had 69% pass rate. Just keep on going up. In Boston, a very large cohort. 3 campuses, proprietary. It's an accelerated program. They weren't meeting the benchmark. They were ready to close. Next. Increased pass rates from 68 to 99% in just 1 quarter. 20 campus college system that I worked in Montgomery. It was a 2-year associate. They had a 35% pass rate and they're up to 85% just by implementing what I just showed you guys.